Story 1. I would rather my taxes go to a communal fund where every United States citizen receives health care than to insurance companies whose only goal is to profit from human suffering. Story 2. Extremely important. No one should have to go broke to afford health care. You should not be harmed if you lose your job because your health care is tied to it. Story 3. Honestly, I would rather my taxes go toward helping someone survive a hospital visit than funding another military jet that might crash during a parade. Story 4. I am all for it. A single-payer system works in many other developed nations. The money savings alone would make it worthwhile here. Story 5. Small businesses could compete. With more competition, prices would go down and job satisfaction would increase. Our health would improve, as would the health of our neighbors. Our young and elderly would be taken care of. Story 6. Unless someone can come up with a better idea, I do not see that we have any other choice but a single-payer insurance system funded by taxes. What we are doing now certainly is not working, and most people would end up paying less in additional taxes than they currently pay for insurance. It would also free employers from having to provide health insurance as a benefit and prevent people from losing health insurance when they lose a job. Story 7. Why wouldn't I? My tax dollars are paying for the military's golf trips on top of how much is poured into the bottomless pit of a military that cannot pass an audit. I would rather it save a life, provide prenatal care for a mother-to-be, help the man down the street avoid bankruptcy while fighting his cancer, and survive. Story 8. A basic level of health care should be guaranteed to all people. Annual screenings and checkups, caps on the price of prescription drugs, and coverage for medical procedures should be included. There should be an option to purchase supplemental coverage if desired and affordable. However, discovering you have lung cancer, your spouse has a high-risk pregnancy, or your child needs surgery should not lead to families facing bankruptcy. People say it would cost too much. I already pay high amounts to United Healthcare for mediocre coverage. I would rather pay that same amount in increased taxes and have confidence that I do not have to wait for approval from United Healthcare's artificial intelligence system for my child to see the specialist who can save their life. Story 9. I support it. Unfortunately, a few insurance companies and healthcare companies have convinced the majority that by doing so, they are receiving worse care or are being told that it is socialism and that socialism is bad. Story 10. As an American living in the United Kingdom, everyone should have access to this system. Not only is it ironically cheaper for the country, but a healthier population means a healthier country. There is a massive reduction in stress when you can be seen whenever you need. I just enter any issues I am having into a website, and the doctor gets back to me within an hour with either an appointment with them or an appointment with the pharmacist for a prescription and a checkup. It is very efficient, and the cost is free except for a minimal payment on medication under £10. Scotland is free, though. I broke my ankle a year ago this month. I had to get major surgery and hardware inserted. Cost me nothing. Literally nothing. Flashback to 2012 when I had strep throat and tonsillitis and was not responding to antibiotics. CarePoint Hospital in New Jersey put me in the intensive care unit for 30 days. The bill was $250,000, and I nearly lost my job. Story 11. Unconditional is not normally used to describe a healthcare system, but if it means everyone receives care regardless of job status or income level, I am in. Story 12. There is a lot to untangle, but ultimately a for-profit healthcare system is doomed to fall apart eventually. Story 13. It would likely be much cheaper and more cost-effective without the chief executive officers and profit seekers. It probably will not happen because it is in their interest to prevent it, and they have all our money. Story 14. Only if it becomes centralized and removes the inefficient insurance industry that is draining resources from people reliant on the system. Story 15. I would love it. One of the biggest complaints about taxes is that they are not being used effectively or for the best purposes. I am not generally one to complain, but I would definitely be happier with this, at least as a start. There would also need to be insurance removed, limits on how much medical charges are allowed, and a broader acceptance of what counts as non-cosmetic procedures. The more cosmetic procedures can be handled by private practices. Story 16. Considering our taxes are funding a $200 million ballroom for a criminal, I would say I am okay with healthcare for all. Story 17, we could do universal healthcare if we wanted to and be just fine. But it is a for-profit business, so people at the top of that business want to keep making money by the truckload. It is going to stay this way. It does not matter what we think or want. Story 18, most Americans want it. We are currently under the control of a corporate autocracy. We also elect the least qualified people. Story 19, why not get everyone healthy so they place less strain on society than when they only seek help when severely sick or close to dying? Because of some Americans' current situation, I bet they would rather endure the pain and sickness and die than live with a medical bill. That is a dystopian reality. Story 20, I am for it. I would gladly pay for a single-payer healthcare system. It is clearly more cost-effective and equitable. Developed countries other than ours have been on top of it, showing us how it is done for years. It is a crime we do not already have it. Story 21, I am all for it. We have a country full of mentally ill people with guns and addictions, not to mention obesity. I think we should be taking care of each other just like Jesus said we should, as the Bible teaches. But what would conservatives know about compassion and empathy anyway? It is not like they actually believe in what their religion preaches. If they did, we would already have healthcare for all. Story 22. I think most people would realize quickly that a universal healthcare system is not only better for health, but also cheaper for the individual than the current insurance system. Story 23. Better than what they are used for now. Subsidizing corporations, sponsoring terrorism around the world, toppling undemocratic governments as though we are one, invading and attacking other countries. Story 24. Perhaps someone can help me with this. The thing is, I find this question a little disingenuous because most people here would benefit more from it than they would pay in taxes. So it is not really accurate to say that your taxes are going towards universal health care. It is more like someone else's taxes are going towards your universal health care. Story 25. Do not make it universal. If it is provided for those who want to pay and participate, that is, opt in, then I would support it. Allow others to continue with a private option. That is the only way I will support this. Story 26. I already pay a lot for healthcare, and I watch while friends who cannot afford it do not get the care they need. We pay for many unnecessary things through taxes, and I cannot think of a better use than spending it on keeping people healthy, especially under the capitalist system that measures your worth by how much you produce. Healthy people are more valuable. Story 27. I am all for it. The Department of Defense has admitted that they do not know where hundreds of billions of dollars have disappeared. They have failed the last 8 audits, simply because money has gone missing that they cannot account for. If the Department of Defense can casually lose billions of dollars every year, then it is clear they do not need it. Put it to better use. Universal health care and a universal basic income for everyone would be a much better use of that money. Story 28. Yes, I am fully supportive. Additionally, the cost of healthcare is excessively high and exploitative, so let us reduce it significantly while we are at it. Story 29. The United States does not need additional funding for the defense budget. I would gladly prefer my tax dollars to go to social services. Story 30. I saw somewhere that people are afraid that others would abuse it. How? I would like 3 Papa Nicolau tests and 6 measles vaccinations, please. Oh no, people would get a yearly physical examination and catch cancer earlier. Story 31. We are going to find out just how serious our situation is in the next 3.5 years as health insurance rates continue to rise, people lose Medicaid coverage, and tariffs increase drug prices. Story 32. As a veteran with access to better healthcare than I ever received in the private sector, I can share that you are already paying for unconditional healthcare for about 5% of the population. As someone who works in that system, I can also tell you that, by the numbers, the government-sponsored healthcare at the Department of Veterans Affairs outperforms the private sector in almost every metric. This means the single-payer system that the rest of the modern world uses has been proven to work in the United States as well. Story 33. I support single-payer healthcare. I also want to note that no country in the world provides unconditional healthcare. There are always conditions. Social policies involve trade-offs. We do not have unlimited resources. Story 34. I'm all for it, without question. I'm currently on my state's Medicaid, Missouri HealthNet. My prescriptions are all paid for and all of my medical treatments tied to my disability are currently covered 100% with no copay. I would love it if everyone had the peace of mind that this brings. I don't have to worry about paying for my medications or paying to see a doctor related to my illness. I would rather my tax dollars pay for that for everyone than subsidize another billionaire company's profits. Story 35. We need to make all healthcare nonprofit first. Eliminate insurance companies, then implement universal healthcare. Alternatively, we can do both simultaneously. Healthcare should be free at the point of use. We are rich enough to provide this for our country. Story 36. Nobody has unconditional healthcare, nor has anyone proposed unconditional or unlimited healthcare. But reasonable healthcare is definitely supported. Our system is currently inadequate. Story 37. Do it. Anyone who has ever been laid off has seen the absurdity of a system where you suddenly have to pay high premiums yourself at the same time that your income has just stopped. It is especially difficult if you get an injury or illness that removes you from the workforce long-term or permanently. It is also very disruptive to get new insurance plans and doctors whenever you change jobs. Tying healthcare to employment is absurd, dysfunctional, inefficient, and immoral. Story 38. Healthcare is a human right. We have more than enough resources to make it happen if we focus on what matters and not capitalism at all costs. Story 39. As long as the oil companies receive their subsidies, we are all good. Ask artificial intelligence how much money we provide to oil companies that are already profitable. Story 40. All for it. Preventive care for all is a bargain. I do not want to keep paying for hip replacements in 65-year-olds that could have been physical therapy when they were 40. If the top 1% of earners paid their fair share of tax, there would be more than enough money to pay for it. The billionaires would still be billionaires, so I do not know what they are complaining about. Story 41. A random high school teacher who gets cancer might not have to start selling meth, betraying his family, ruining his life and the lives of several innocent others, including random plane crashes, and generally becoming a living train wreck that people watch for their amusement. Instead, he could just get cancer treatment. Oddly specific, I know. No clue where that came from. Totally. I feel like pizza. Story 42. What is the alternative? Tell people who need medical care to go away. Of course I am for it. Story 43. As a healthcare worker, I fully support it. In the long term, it would reduce costs because we spend a great deal of money managing illnesses that could have been prevented with preventative healthcare. It is cheaper to provide someone with a lifetime supply of insulin than to treat them for diabetic ketoacidosis in the intensive care unit. Hypertension medications are much cheaper than dialysis, among other treatments. Our current system is a complete failure unless you are in a senior position at a private hospital or insurance company. Story 44. I would definitely prefer that over a $200 million ballroom that none of us will ever see. Maybe that is just me, though. Story 45. I believe all people should have access to free, unconditional healthcare. That should be a right. Anyone who feels otherwise is wrong. Story 46. I would rather help pay for universal healthcare than golf trips, ballrooms, golden tidbits in the Oval Office, military birthday parades, illegal prisons, kidnapping squads, extra secret service because his wife cannot stand him just like the rest of us. Should I continue? Story 47. I have zero problems with my tax dollars going to treat someone's cancer. I am not okay with funding bombs that get dropped on Palestine. Story 48. It would bankrupt the nation. There are over 300 million Americans. Stop comparing the United States of America to European nations with populations under 50 million, who rely on the United States of America for defense and can keep the defense savings. Story 49. We have two choices. 1. We spend a lot of money to give people access to every small part of healthcare, instead of treating only the severe cases. When they catch something early, they deal with it quickly and easily. 2. We save money now by denying that access, but end up paying when today's easily treated tumor becomes next year's extremely expensive stage for cancer diagnosis. One choice is cheaper, easier, and causes less suffering. The other requires people to think long-term, Apparently, many Americans struggle with long-term thinking. Story 50. Unconditional? What does that mean? I support universal healthcare and Medicare for all. We do not need to find different ways to phrase things. The model that basically every other developed nation uses will be fine. Story 51. I think we need to understand what unconditional means. Is the person old? Healthcare anyway. Is the person disabled? Healthcare anyway. Is the person transgender? Healthcare anyway, and make it gender affirming. Is the person taking poor care of themselves? Healthcare anyway. Is the person a science denier who suddenly wants a doctor to fix them after superspreading? It's a shame, but healthcare anyway. Is the person not American? Healthcare anyway. Is the person a criminal? Healthcare anyway. I would gladly give every cent I currently spend on mediocre medical insurance through work if it could go to truly universal healthcare. Anyone upset about an undocumented person getting it too can move to another country where they will be happier. Story 52. The first thing that needs to happen is that all the for-profit health insurance companies should be converted to non-profit organizations, such as a 501(c)(3) charity, so that profit is not the main driver. I am currently paying over $1,400 a month to cover 2 adults with no serious health conditions, and this is a bronze plan. Anything has to be better than that. Story 53. Covering all reasonable treatment under a single payer system would save significantly compared to having Medicare, Medicaid, TRICARE, native healthcare systems, the Children's Health Insurance Program, the Affordable Care Act, employer plans, private plans, and high-deductible plans with the choice of flexible spending account or health savings account for your health maintenance organization or preferred provider organization. Unless you have fear of missing out, so you choose an exclusive provider organization, but if you need an out-of-network specialist, that is not an option. Story 54. I am fully supportive. For decades, our tax dollars have been funding Israel, a country with universal healthcare. Not only have our tax dollars supported their universal healthcare system, but they have also funded efforts to create an ethno-national state through genocide, which I find unacceptable. It would be unreasonable to oppose universal healthcare for my fellow Americans while our tax dollars support countries that receive benefits we do not have. Story 55. I would be very happy if I knew that money was helping someone with medical needs. I do not care who they are or why they need it. They are a human being and deserve to live a happy and healthy life. It is shocking that anyone can justify deaths because someone was too poor or did not have the right background. Please just treat people like people. Story 56. Universal healthcare has been shown by studies to be cheaper than our current system by trillions of dollars. I think we should have universal healthcare, and if people want private health insurance, they can pay for it out of pocket. The propaganda against universal healthcare has been very effective here. People have fallen for it completely. If I have to hear one more time about wait times for specialists in some area of Canada, I am going to scream. People here don't realize our current system will prioritize profit over people's lives. Everyone knows they will let you die if you can't afford care or medicine. They don't realize the hospital will perform surgery even when they know you're too fragile because the hospital makes more money. It used to be that doctors could say a patient was not stable enough for surgery at that time. Since COVID-19, hospitals override doctors' decisions. I had to leave nursing. It is not about getting people better or helping them heal. It is all about money. Story 57. I assume that unconditional healthcare means universal healthcare, considering that every report on the subject, even from Republican sources, has determined that universal healthcare will save us trillions of dollars over the first decade. This sounds great to me. Story 58. Without reading all of the nearly 800 comments at this point in time, I have always thought I would find comfort in the idea that if I ended up unemployed and hurt myself somehow or got some disease that I could not help, I would be covered. Meanwhile, my extremely conservative Republican brother is still one of the types that says, why would I fund some junkie's medical care from his recovery or some unemployed person from a broken leg? It is my personal belief that with modern medicine, there is no reason that healthcare should not be available to all human beings. None of us are worth more or less than others, especially not billionaires. You, an average person from Iowa, deserve the same healthcare as Bill Gates, Jeff Bezos, or Elon Musk. Anybody who says otherwise is against humanity. They have no human decency and no conscience about it. This is why I do not really care what a certain individual did to a certain healthcare executive last year. That healthcare executive led his company to higher and higher profits at the expense of the average citizen of America. Approximately 170,000 of us die each year from something that could have been prevented. I even had appendicitis, and I waited until it was almost killing me. I was doubled over in agony on the floor, unable to stand before I went to the hospital because I was afraid of the medical debt. That is a poor and pathetic existence for a first world country. Get better, America. This situation is unacceptable. Story 59. That is about one of the best things our taxes could be used for. It is much better than funding wars in other countries or funding human immunodeficiency virus medications in countries that are unfriendly to us. Story 60. I think an important issue Americans overlook is the additional money we spend on healthcare. Other countries not only have coverage but also no deductibles to meet and no copays. Story 61. I think that tying health insurance to employment causes significant stress for individuals, especially those with families or during a recession. Story 62. I would gladly pay my taxes so my fellow human beings and Americans could get healthcare. A single-payer program would suffice. We could change the healthcare monopoly to a monopsony. This would actually be cheaper than our current system. Plus, employers would not have to provide healthcare to employees. Investing in the American people yields the greatest results. Story 63. I think the United States government could not be trusted with full universal health care. Instead of funding healthcare providers, we would just be funding government officials. I do believe there needs to be an insurance overhaul. First, we need to cut out the insurance lobbyists and put caps on costs. Story 64. As opposed to my untaxed dollars making insurance companies richer, I spend more per month on health care than I do on federal taxes. Story 65. I prefer my tax dollars going to health care or paid family leave instead of $75 billion for immigration and customs enforcement or a black box for military spending. Story 66. I would much rather pay for universal health care than continue funding many of the current uses of my tax dollars. Story 67. I am for it. Healthcare in this country is inadequate. I have been healthy for years and have probably spent between $150,000 and $200,000 on health insurance over 20 years of work. Even when I get sick, I still owe a deductible and copayment. Unfortunately, it will not change until people either fully use health savings accounts and build a fund to eliminate insurance or crowdsource through various companies to bypass big pharmaceutical companies and insurance providers. There is too much money lobbying corruption in government for those responsible to take a stand and provide basic health care from the taxes we all pay. Story 68. Will make healthcare 10 times worse with bureaucracy, regulation, and associated corruption. The Dutch model is far better. Story 69. I am for it. Remove the middleman and increase profit. Those two factors are what is wrong with our healthcare system. Story 70. The United States healthcare system is a joke. It is broken and needs to be fixed. Why are we the only industrialized nation without some kind of universal system? Greed, that is why. Story 71. It would be nice to see my taxes go to help society and not just corrupt politicians and their associates. Story 72. What is with all these annoying, what do you think or feel questions lately? Has Reddit completely turned into engagement farming nonsense? Of course, Reddit wants universal healthcare if they do not already have it. This is just a pointless attempt to gain approval. Story 73. It would be cheaper than what we are currently doing. Years ago, the Heritage Foundation determined it would cost $1.2 trillion a year for universal healthcare. At that time, Americans were paying $1.4 trillion a year on medical-related expenses, including insurance premiums, copayments, and out-of-pocket costs. Story 74. Insurance companies will never let us switch to a system where they are not needed. They will lobby and bribe every politician. My doctor ends up receiving $10 for my visit. I realize they receive a lump sum for signing up with my health insurance provider. Why can't I just pay her $10 and avoid all the insurance forms? Story 75. What is unconditional healthcare? Plastic surgery for all? No way. Non-traditional and proven medicines such as chiropractic and naturopathic homeopathy? Unlimited therapy for everyone? Gender-affirming care for minors? If unconditional care means only medicine and surgery that improves duration or quality of life for a majority of people using it, then I would be more than willing to subsidize insulin. I would not be so happy about subsidizing a drug that helps 3% of patients live 3 months longer. The trouble lies in where you draw that line. How much does politics play a role? For instance, are you going to treat the premature infant who needs millions of dollars of care throughout its life? Or will you deny abortions? These are hard questions, especially when the funding is limited. How do you handle doctor shortages? Who gets priority? Or do you switch to some algorithm system on electronic health record software? How do you deter overuse? Doctor shopping? I do not like our current system at all, but I really do not want my medical care handled like the Department of Motor Vehicles handles licensure. Story 76. Since the Koch brothers proved that universal healthcare is cheaper than the current system, there is no reason to avoid it. At this point, the government could reduce private payer costs significantly by competing with the name-brand drug manufacturers. At one point, they said the EpiPen costs $3 a unit to produce. Even if it costs $10 or $15 for good measure, there is still no reason it should be a $50 product or $300 to $500 after the patent was bought. Story 77. There is no reason not to, as it benefits me in every way. It already does. It would be cheaper. Care would be better and faster. I would rather it go to that than to wealthy people, the military, and law enforcement. It would improve my community. It would create freedom. Story 78. Yes, please. I don't mind if it costs me a bit to ensure I and everyone else around me get the healthcare they need. However, this also needs to come with the dismantling of the healthcare racket. It shouldn't cost patients tens of thousands to millions of dollars to get healthy, all because for-profit hospital and pharmaceutical shareholders demand endless financial growth. My taxes will only make a tiny dent unless that greed is addressed as well. Story 79. Not pooling your resources to care for the sick is barbaric, and every industrialized country knows this, with the United States as the lone exception. Story 80. Taxes as in single-payer, Medicare for all, or whatever you want to call it. I would be fine with it. Start it yesterday, as far as I am concerned. I would love to not be ruined or lose everything due to a medical issue, gallbladder surgery, or something similar. It would also force employers to find new ways to attract employees. Story 81. I think that government involvement is the problem. If there was a government requirement but it was optional for private companies with insurance companies removed, it would be best. This is one of the biggest and deepest scams in the United States. Don't believe me? Check online for healthcare procedure costs with and without insurance. Hospitals and clinics absolutely take advantage of the system, and that trickles down. What we currently have is subsidized healthcare, but it is not insurance except in name only. Story 82. It would be cheaper for everyone. As it is, we pay monthly for insurance, ranging from hundreds to thousands of dollars, which only takes effect after we meet a certain deductible. Then it only covers a percentage of the bills, which are highly inflated due to insurance plus copayments. Having a baby costs on average $10,000, and that is if things go well. Any complications cause the cost to skyrocket. That is equivalent to 5 years of taxes, not including all the other costs leading up to that or any follow-up care. All of that is if insurance agrees to cover it in the first place. Additionally, the poorer you are, the more expensive your health care is. You face a higher deductible and lower percentage covered by insurance. Some plans even work as reimbursement, so you have to pay the cost yourself upfront and hope they will pay you back. Story 83. Why haven't we? That's literally one of the things Jesus said to do. Heal the sick. Keeping people sick so you can virtue signal about it is the opposite of what is supposed to happen. Yet it is the party of Jesus that is opposing it. Story 84. Universal or unconditional? What is unconditional health care? Do you get covered access to every procedure you want, with or without a need or recommendation? That just sounds dangerous. Story 85. I support it. I would rather pay $10 more in taxes to fund healthcare for everyone. Private insurance is far more expensive anyway and often denies assistance when we need it. Story 86. 100%. Use my tax money to provide healthcare for everyone. Stop tying health benefits to employment and welfare. Story 87. It is worth pointing out that the United States spends more public money per person on healthcare than many countries with universal coverage. Story 88. I want my taxes to go to helping people in society, not wars, not glamorous projects, and not politicians' pockets. Story 89. Not American, just posting to mention that the entire rest of the world already knows the answer to this question and is making popcorn in preparation for the United States response. Story 90. 100% for it. Healthcare, the basic fundamentals of keeping people alive, should be provided for all. It should be free or extremely cheap at the point of use to everyone. We can consider implementing some cost-sharing measures like a small copay for a visit and a relatively low out-of-pocket maximum, similar to what some countries have. For example, Finland charges about 20 euros for a doctor's visit and has an out-of-pocket maximum of 700 euros. Overall, healthcare should be free or nearly free. Whatever system we use to achieve this is acceptable. People often look to Canada because they are our neighbors. To be honest, I wish we would look to France or the Netherlands as a model for the United States. I would not choose to mimic Canada's system if given the choice. However, I do not think it will ever happen in the United States. The brainwashing of the population to think anything that helps the community is somehow evil communism is deeply ingrained. I do not know how to overcome that programming. I find it ironic when people say they prefer to have a choice when they get health insurance. That choice is usually limited to the one healthcare plan offered by their employer. Yes, many options there. Story 91. Healthcare is exploitative. It resembles a modern mafia that demands excessive payment for inadequate protection. They do not prioritize health. Story 92. You do realize that is a fallacy. Every country that has a national healthcare program has conditions, many conditions. I am not against it or for it, since no one has presented a plan to review. Story 93. Big fan of the idea. We do not need to allocate so much money to our military or to corrupt politicians and can take some of that money for good things. Story 94. I would love for my tax dollars to go toward universal health care. I would prefer it actually, instead of those same dollars going to bailing out shady and corrupt health insurance companies who exploit the sick and needy constantly. Private health insurance is the real barrier preventing America from being healthy again. Story 95. I think maybe my insurance would not have been able to deny my cancer treatment, essentially handing me a death sentence. Story 96. The United States is the biggest scam economy. As long as there are safeguards to prevent it from being stolen by politicians, and it never goes overseas to dual citizens or non-citizens, it is acceptable. We do not have it now because the insurance companies are lobbying against it. Story 97. Why can't we just do what China does? Hospitals in China have two categories: government-owned and private-owned. Both are extremely fast. There is no so-called family doctor who knows a bit of everything but masters none. The process in China works like this. You get to the hospital, there is a triage where you explain your symptoms. That person directs you to the corresponding department. They ask, do you want a master doctor? Doctor with more than 10 years of experience? Or a regular doctor? Doctor with less than 10 years of experience? You pick the one you want. A master doctor costs about $10 and a regular doctor about $7. Then you take the ticket to the corresponding doctor, explain your symptoms again, and they decide if you need lab tests. If tests are needed, they order them through the computer and you go to the lab floor. Testing is done with results back within 3 hours. You take the results to the doctor, who reviews them and explains what is going on and what you need to do. If medication is necessary, the doctor writes the prescription on the computer, which is sent to the pharmacy on the first floor. You go to the first floor to get your prescription. The whole process is done in less than 4 hours if the condition is not serious. For minor conditions like eczema, the visit takes less than an hour, including getting the prescription. I do not understand why the medical system in the United States is so complicated, unnecessarily so. Perhaps it is designed to maximize profit. I have insurance in the United States, but every time I return to China, I get a full body exam. It takes about a whole day to check every organ in your body, then have the results explained, along with recommendations for future treatments and diet. All of this is done in a day and costs about $150. This price is for foreigners. If you have Chinese insurance, I assume the cost is almost nothing. Story 98. Our current insurance situation is a travesty. It is crazy. The victim has become the perpetrator because we pay into a convoluted system we cannot understand and think socialized healthcare is the devil. Most Americans believe our healthcare is top-notch. It is not. Not even close. Large insurance companies fund campaigns designed to make us believe their own solution is best. I hope more chief executive officers get what they deserve from the people they systematically exploit. Story 99. American nurse here. I want this so badly for my country. I have seen the outcomes of people ending up crippled for life because they lacked health insurance or the money to pay out of pocket. I have been lucky to escape that when I didn't have health insurance for 5 years. Looking back, there were times it almost killed me, such as when I had a fever for a week I couldn't break despite cool baths and alternating ibuprofen and acetaminophen. Here is the reality of life. Good health, if you ever had it, doesn't last forever and can end very suddenly. Story 100. I would totally be interested. In fact, if we started doing this, I would contribute the maximum allowable amount every year because that kind of greatness deserves to continue well beyond my lifetime. Story 101. I'm on board with that. However, I am also a capitalist, believing that the best and smartest doctors should be paid their market value. On the other hand, $800 for Tylenol in the hospital is a problem. Story 102. I would like more details, but generally I am supportive of government-funded healthcare for all citizens. Story 103. In all developed countries except the United States, this is how it works to a greater or lesser extent. The United States tax and premium money is twice as much as tax alone for those other countries and results in worse outcomes for United States citizens in quite a few metrics. Story 104. It is better for healthcare to be provided through public healthcare systems than to be given to healthcare insurance companies or sent overseas to countries that use it to fund human rights violations. Story 105. We are indirectly taxed through high costs of care and insurance premiums to subsidize those with chronic or severe illnesses or people who cannot afford the services they receive, such as emergency room visits by the impoverished. We have deceived ourselves about the nature of these costs. For example, my medical insurance monthly premium costs approximately 1/6 of my salary, which I consider a tax collected by a private corporation, Blue Cross Blue Shield. I rarely use the service myself, and when I do, the services are often out of network. The only real benefit I receive is price negotiation. Most of my premium goes to the insurance company, and the profit they generate from me is theoretically offset by costs incurred by other subscribers. Ultimately, my privatized tax helps subsidize the medical care of others. The primary difference between privatized healthcare and public healthcare is the presence of a middleman who takes a portion of the funds. There is extensive manipulation within the medical industry to obscure real costs while generating profits, occurring at the intersection of the medical, pharmaceutical, and financial insurance industries. Paying out-of-pocket removes access to the price negotiation provided by insurance companies, leaving only artificially inflated prices. Not having medical insurance in the United States is effectively a death sentence, coercing people into having coverage. Therefore, it functions as a tax in all but name. Story 106. This needs to be the #1 policy promoted in 2028. If the Democratic Party wins, they should adopt former President Donald Trump's strategy and advance Medicare for all as quickly as possible. Just get it done. Story 107. Okay, better than what we have. However, the current administrator could never handle that. They would steal from it completely. Story 108. Insurance companies prioritize profit over patient care. Healthcare should not be privatized. Story 109. I do not mind it as the cost of healthcare spirals while the quality and availability worsen. However, I do not want it in the form of another tax or state exchange. I would rather see a federal system funded by reallocating dollars from far less critical grants and programs. Story 110. I already pay $800 per month for my insurance that I barely use. It has a high deductible, so I am also contributing to a health savings account. I would rather walk into a doctor's office, clinic, or hospital knowing I will not have to pay more money. I understand there can be downsides to universal healthcare for all, but the benefits outweigh the risks for everyone. Story 111. Literally every single study says it would be cheaper and we could get even more care than we need at the same cost. The only reason we don't have it is because it helps people who cannot afford lobbyists. When every nation in the world has it except for the nation that held 25% of its GDP despite being 4% of its population, you know something is fundamentally broken about that nation. Yes, even Mexico got it in 2010 and has had 15 years to refine it for their population while the United States did nothing. Story 112. I do not agree with free healthcare. I have worked in fire and emergency medical services, and people on Medicare abuse it to the point that medical personnel absolutely hate their jobs and resources are pulled from people who actually need them. Have you ever been called for a toe pain complaint, where an engine crew and ambulance were dispatched but unable to respond to a rollover accident with a child trapped because they had already made patient contact with the toe pain caller? The next available units were 25 minutes away. Kills your faith in humanity. Story 113. I am very much in favor of it as long as we also eliminate health insurance companies. They generate so much profit that we could almost pay for universal healthcare just from those savings. Story 114. That would bring us closer to a functioning society. I am American, grew up in the United Kingdom, so I am biased by experience. After moving back to the United States, I took healthcare for granted because I was always in full-time jobs with healthcare. I have been freelancing for 2 years and cannot believe this does not come out of my already high taxes. Story 115. Why would I be angry if someone receives help? Everyone owes a debt in life. It is called death. We should all agree that it should not be as painful and debilitating as possible. I can help less fortunate people with my tax dollars. That is what they are supposed to be allocated for. Story 116. A single-payer system is literally and mathematically the most efficient system. It is one giant insurance company where we are all in the same pool without layers of profit. It would not be unconditional. You could not request unnecessary care or get free cosmetic surgery. Every other developed country has done this, most have better outcomes, and all have lower costs. Story 117. I have zero issues with my tax dollars going to universal healthcare for the United States. The number of people who have had their lives more or less ruined because of medical bills is insane. You should not have to go bankrupt and become homeless just because you have a condition outside of your control. Our taxes often go toward things most of us will never use or even see in our lives as citizens. I do not care about our military strength. I care about getting old and being able to fix things that would otherwise make my elderly life miserable. Story 118. In all Western countries, healthcare is a right of citizenship. It is not tied to your job. Since the bills are paid directly by the government and do not involve insurance companies, they actually pay less money for more care than the United States. Therefore, if the United States introduced single-payer healthcare, they would actually save money. Story 119. I would rather my tax dollars be spent on this than on the bloated military budget or end up in a billionaire's pocket. Story 120. I feel sorry for you all Americans, and I do not know if it is the pity or disappointed kind of sorry. Every small but good progress the Affordable Care Act has made for you has pretty much been undone in under 10 years. The United States is the only developed country I can think of that can arbitrarily undo federally mandated measures just because the person in charge disagrees with them. You are also the only developed country I know that is very hesitant to create constitutional amendments for the betterment of your people just because you think your founding fathers should not be questioned. Amendments against the Second Amendment? No, that is too much. But let us stack the Supreme Court so far to the right and then get them to overturn Roe versus Wade. That is much better. Let us slash Medicaid for those who benefit the most from it, and proclaim healthcare as a right only to those who work. America is unreal. Story 121. Totally in for it. We are already subsidizing people who cannot pay through the high costs of private insurance. Story 122. I am all for it. We need to be about more than just billionaires and fighter jets. It is honestly a poor example for the world when we could do better. Story 123. As of 2020, around 63% of Americans believe that we should have some form of single-payer healthcare, either fully government-led or a mix of government and private insurance. Most people agree that our healthcare system is inadequate and needs to change. Story 124. The taxes taken out of my paycheck would go up a little bit, and the health insurance costs taken out of my paycheck would drop to zero. Story 125. Full support. This is what taxes are for. We should at least get what our money buys from our representatives. Story 126. Even my boomer Trump supporter father with Medicare and concierge medicine does not like the insurance and pharmaceutical companies. So I think everyone supports Medicare for all or Medicare buy-in. Story 127. It is actually ridiculous and crazy when you think about it. Just remove insurance. Just tell pharmaceutical companies to stop their price gouging. What are they going to do? Not sell to the largest market. Pay hospitals directly. That alone can save healthcare. If the government actually had our best interests in mind, they would do this. Story 128. It is better than giving it to the wealthy bureaucrats and politicians in Washington who exploit us daily for trivial matters. Story 129. Well, they ran the numbers and it is considerably cheaper overall and all Americans would be covered. That is not a surprise. 32 other developed nations have successfully implemented single-payer healthcare, and they have cheaper healthcare with better outcomes. Story 130. I am very much in favor of it. Somebody will say, but death panel. We have death panels, they are called insurance companies. Unlike government panels, private insurance death panels cannot be voted out. Story 131. I am a socialist. I want my tax dollars to go towards helping people, children, and the community. We are currently experiencing taxation without representation. They have no plan to stop you from paying into Social Security or Medicaid, but they are going to reduce funding for those systems. So where is that money going? To people who do not need it. Story 132. I will be honest. I have always liked the concept, but I am now as upset at supporters of Donald Trump as they are at me for being more liberal. I do not feel a sense of community enough to want to share resources like that. They are literally against vaccines and science. They can fully live with that choice. I want to not pay taxes. We started as a tax revolt. Let us end that way too. Story 133. No, I think letting people rot and die because they run out of invisible made-up currency is totally the wrong move. Also, I do not support insurance companies practicing medicine without a license, or doctors denying people care based on personal beliefs after swearing an oath. Our system is broken as intended, and the majority wants people not to die on the street. But here we are. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.